My name is Neota Bella. I am Chief Scientific Officer at ICHOM. I'll be sharing with you who ICHOM is, what's exciting about this journey of value-based healthcare excellence and patient-centric quality improvement that you're embarking on, and also to share some tools and resources that are available to you through ICHOM and our partnership. ICHOM is an independent international nonprofit organization with a mission to unlock value-based healthcare by defining global standards of measuring outcomes that matter to patients. Not only do we do that, but we also drive global use and transparent reporting based on these outcomes in a way that helps generate insights that can benefit patients, clinicians, provider organizations, payers, policymakers, industry, and other stakeholders in the healthcare ecosystem. We were founded in 2012 by thought leaders in value-based healthcare, and they include Michael Porter at Harvard Business School, Stefan Larsen at Boston Consultancy Group, and Martin Ingber at the Karolinska Institute. We focus on the numerator of the value equation, that is capturing patient health outcomes and being able to prioritize and standardize measurement of these, very much co-designed with patients. We believe that our sets are unique in several ways, and they are key to ensuring that care serves the needs of patients, and that care and improvement in quality of care and clinical pathways is based on evidence, and also being able to interrogate outcomes and understand disparities and inequities in the health status of different groups and segments of patients. Ultimately, our sets are key to transitioning away from fee-for-service towards fee-for-value models of care. ICHOM sets provide a framework for collecting data that can holistically inform users of how a patient is doing and the impact of treatment and the care that they're receiving. The sets are unique in several ways, and this really relates to the principles that guide the way that the sets are developed, and these are outlined here. First and foremost, our sets are co-designed with patients. So patients who are lived experience experts and also lived experience experts who represent patient organizations form part of the working groups. They are active voting members of the working groups and are part of the working groups from the get-go. Secondly, in our sets, outcomes predominate. You will have come across a variety of healthcare metrics, and some of them typically emphasize processes of care. ICHOM sets focus and emphasize results of care. So these include results that are typically reported by clinicians, such as survival and disease control, but they also include health status that is reported by patients, directly from patients, which is really key to being able to capture not only symptom burden, but functional status and the physical, mental, and social aspects of living, as well as overall health-related quality of life. In addition to outcomes, our sets also include case mix variables. So these are factors that are characteristics of patients that are important to take into consideration if you're going to make comparisons between one group of patients and another, or one group of patients taken care in a particular hospital and another. These include demographics such as age and sex. They include social determinants of health like education and housing situation and race and ethnicity. And of course, they include comorbidities and severity of disease. To date, we have 45 sets spanning a variety of clinical areas, including oncology, cardiovascular diseases, mental health, pediatric conditions. All told, our sets cover conditions that account for nearly 60% of global burden of disease. They have been developed with a global community of over 1,000 experts from around the world, and that's growing. And they've been implemented in over 400 care settings in 42 countries. And we are really thrilled to be able to partner and support organizations such as yours. And furthermore, recognize those that are excelling, including through ICHOM's Value-Based Care Accreditation Program.